Hello, namaste everyone. In this video, we will talk about the necrosis. This is the chapter of the general pathology of the first year MBBS. Now, let's discuss about the necrosis. Let's go ahead. It is a form of a cell death. Likewise, apoptosis is the form of a cell death. In this, the cell membrane loss. There is cell membrane loss of cell membrane. There is a leakage of cellular contents. This elicits the inflammatory response, and this affects the tissue beds, and it results in the gross and the microscopic changes. Necrosis. So there are the two major types of necrosis. There is coagulative and the liquefactive, and there is also the other types of necrosis: caseous necrosis, fibrinoid necrosis, fat necrosis, and the gangrenous necrosis. So all together there are the 6 types of necrosis. We will discuss all the types of the necrosis. First, let's discuss about the coagulative necrosis. Now, in the coagulative necrosis, there is a preservation of tissue architecture for a days. Okay, there is the preservation of tissue architecture, and injury damages the cells and the enzymes. So the major difference from the liquefactive frequency, this coagulative necrosis damages the cells and enzymes. So there is a loss of enzymes. It limits the proteolysis, and due to the loss of enzymes that limits the proteolysis, the tissue architecture remains intact for days, so that there is a preservation of tissue architecture for the many days. And now the phagocytosis of the cell remnants takes place. In the gross of the coagulative necrosis, we will see the tissue becomes the form, and in the microscopic architecture is preserved. In the microscopy, we will see that the architecture of the cell is preserved, cell nuclei lost, and the red or pink color on H and E stain, cell takes of the more stain, and there are inflammatory cells in the microscopy. So in the example it is seen with the infarctions and ischemic myocardium, kidney, and spleen. Exception is brain. There occurs the liquefactive necrosis. So in this way we can write in the university examinations about the coagulative necrosis. Now let's discuss about the liquefactive necrosis. The liquefactive necrosis is the abscess or the bacterial, fungal, and the brain infarction. It is caused in the brain infections but it is poorly understood the mechanisms. So infections draw the inflammatory cells, and the tissue is liquefied into the thick liquid mass. Enzymes from the microbes is released, and now the enzymes from the lysosomals of the dying cells is also released. And in the gross, we will see the liquid or the pus or abscess cavity, and in the microscopic we will see the numerous neutrophils. Similarly, in the caseous necrosis, this necrosis is cheese-like and rarely occurs outside of the tuberculous infections. Mycobacterium resists its digestion, and the macrophages form the giant cells, and there is a slow breakdown of infection, and the mycolic acid and the lipid gives the cheese-like appearance in the caseous necrosis. In the grossly, we will see the cheesy-like caseating substance, and the microscopic we will see the granulomatous inflammation. In the granulomatous inflammation, there is necrotic center. There is a ring of lymphocyte and the macrophages and epithelial cells, and there is a giant cells. These giant cells are the fused activated macrophages. Now, in the fat necrosis, there is a necrosis of fat. Classic example is acute pancreatitis. In the acute pancreatitis, there occurs the fat necrosis. The cause is the lipase is released from the pancreatic cells. So there is a breakdown of peritoneal fat, and these fatty acids combine the calcium, saponification occurs, and the chalky white tissue appearance occurs in the fat necrosis. Similarly, the fat necrosis of breast occurs. It results from the trauma, often biopsy, surgery, and then it mimics the breast cancer. Next, there is a gangrenous necrosis. This is a soft type of coagulative necrosis. This is also caused by the ischemia and the lost blood supply to the limbs or the bowel. There is multiple tissue layers involved in the gangrenous necrosis. There are 2 types of gangrene: dry gangrene and the wet gangrene. In the dry gangrene, the tissue appears the dry, black, shrunken tissues. And in the wet gangrene, there is a superimposed bacterial infection in the wet gangrene. In the cognitive and the liquefactive necrosis, both are present in the gangrenous necrosis. Moist, soft, and the swollen tissue, pus, foul smelling. Now, next is the fibrinoid necrosis. It occurs in the blood vessels. This fibrinoid necrosis occurs in the blood vessels. Is only visible under the microscope. There is no gross finding in the fibrinoid necrosis. It occurs in the autoimmune disorders, that is the antigen antibody complexes deposition in the vessels wall, and type 3 hypersensitivity reactions. This fibrin leaks in this necrosis. The fibrin leaks into the vessel wall. This pink on the, which is in the pink on the microscopy. The classic disorders is the polyarteritis nodosa, that is purpura, renal failure, and the neuropathy. This is the classic disorders in the fibrinoid necrosis. Severe hypertension, preeclampsia, these are the not autoimmune. It damages the vessel wall or the fibrin leak. So these all are about the necrosis and all types of necrosis. You can make the note. You can make the note from this by taking the screenshot of all the notes, and you can write these in the university examinations. Thank you.